What I'm about to share could completely change how you think about circulation after 60. Not because it's complicated, because it's unbelievably simple. So simple that most people ignore it. So simple that your doctor probably never mentioned it. And yet research clearly shows that this one morning habit can improve blood vessel flexibility, reduce arterial inflammation, support healthier blood flow, help warm chronically cold feet, and improve walking tolerance over time, and it costs less than a cup of coffee per week. I'm Dr. Emily Carter, and before I tell you what this is, I need you to stay with me, because this is not about a miracle cure. It's about understanding what is happening inside your arteries and how one specific natural compound can support that process. By the end of this video, you'll understand why circulation declines after 60, why medications sometimes aren't enough, what inflammation is doing to your arteries, and how to safely support vascular health naturally. First, comment below, do you have cold feet, leg pain when walking? Have you been told you have circulation issues? Type circulation issues, so I know how many of you are dealing with this. Now let me tell you about Margaret. Part 2. Margaret's story. Margaret was 68. A retired nurse. For 40 years, she took care of everyone else. Then, suddenly, she needed help herself. It started with cold feet, not just slightly cool. Ice cold. Even in summer, even under blankets. At first, she thought it was aging, but then the numbness began. She couldn't feel her toes properly. Walking felt strange, like walking on blocks instead of her own feet. Then came the calf pain. When she walked more than a few blocks, her calves cramped, a deep, aching tightness that forced her to stop. She would stand there waiting for the pain to ease. After resting, she could walk again, but the distance got shorter and shorter. A mile became half a mile, half became a quarter. Eventually, she could barely reach the corner. Her doctor diagnosed peripheral artery disease, narrowed arteries, plaque buildup, reduced blood flow. She was prescribed medications. She took them faithfully. There was some improvement, but not enough. The fear didn't leave. Her father had suffered the same disease. He ignored it. It progressed. He lost a leg. He died weeks later from complications. Margaret remembered everything, and now she felt like she was following the same path. Cold feet at night, checking her toes constantly, watching for color changes. Terrified. Her quality of life collapsed. She stopped walking to the farmer's market, stopped walking to her daughter's house 3 blocks away, missed birthdays, missed school plays, missed moments. Not because she didn't want to go, because she couldn't walk there. She wasn't just losing circulation, she was losing independence. When she came to see me, she said, "I don't want to lose my leg. I don't want to end like my father." And when I reviewed her records, something was missing. No one had asked her what she was eating. No one had discussed vascular inflammation. No one had addressed the health of the artery lining itself. They were managing blood flow, but not supporting vessel function. And that's when I explained something to her that I'm about to explain to you. Part 3. What's really happening inside your arteries? Your arteries are not just tubes, they are living tissue. Inside each artery is a thin layer of cells called the endothelium. These cells produce a critical molecule that allows blood vessels to relax and widen. When these cells are healthy, arteries expand easily, blood flows smoothly, oxygen delivery improves. When these cells become inflamed, arteries stiffen. They cannot dilate properly. Blood flow decreases, even if blockages are only moderate. Inflammation damages endothelial cells. Oxidized cholesterol worsens the damage. The vessel becomes stiff. The artery loses flexibility. This is why circulation declines gradually. It is not only about plaque. It is about vessel dysfunction. Medications often help manage symptoms, but if inflammation continues, the artery lining cannot recover fully. So what supports endothelial health? What reduces vascular inflammation naturally? What helps protect against oxidative damage? This is where the compound found in cloves becomes interesting. Now let's talk about cloves, not the oil, not a high-dose capsule, not something extreme. Whole cloves, the small dried spice that's probably sitting in your kitchen right now. Cloves contain a natural compound called eugenol. Eugenol has been studied for decades. It has three major effects that directly relate to circulation. First, it reduces inflammation in blood vessel walls. Second, it supports endothelial function, meaning it helps those inner artery cells do their job properly. Third, it has antioxidant properties that help protect cholesterol from oxidation, which is one of the triggers for arterial inflammation. When endothelial cells function better, they produce more nitric oxide. Nitric oxide is the molecule that tells your arteries to relax. When arteries relax, they widen. When they widen, blood flows more easily. When blood flows more easily, oxygen reaches your feet, your calves, your muscles. Cold feet warm up. Walking improves, cramps reduce, not because a muscle was forced to relax, because circulation improved. Now here's what's important. Cloves are not a replacement for medical treatment. They are not a miracle cure, but they can support the inflammatory side of vascular disease, something medications don't always fully address. This is what we added to Margaret's routine. Every morning before breakfast, she would take 2 whole cloves. She placed them in her mouth and chewed them thoroughly. Very thoroughly. Cloves are strong, spicy, slightly numbing. That numbing sensation is the eugenol being released. She chewed until they became a paste, then swallowed. The entire process took less than 1 minute. That was it. No complicated routine, no expensive supplement protocol, just consistency. Within 2 weeks, she noticed her feet felt slightly warmer at night. By week 3, the numbness had improved. By week 4, she could feel her toes more clearly when she moved them. Around week 5, her walking distance began to improve. The cramping didn't disappear overnight, but it eased faster. By 2 months, she was walking significantly farther before discomfort began. When we repeated circulation testing later, there was measurable improvement in vascular function. Not perfect, but improved. Her arteries were functioning better. Inflammation markers had decreased. She wasn't cured, but she was improving. And improvement changes everything psychologically. She started walking to the farmer's market again, slowly at first, then confidently. She walked to her daughter's house, 3 blocks, the distance that had felt impossible. Her grandchildren ran to hug her. That moment mattered more than any lab result. Now let's talk about how to use cloves safely. Use whole cloves only. Buy them from the spice aisle. They should smell strong and slightly sweet when squeezed. Every morning, take 2 whole cloves. Chew thoroughly. Do not swallow them whole. Chewing releases the active compounds gradually. After chewing fully, swallow. You may drink water afterward if the taste is intense. Consistency matters. This works gradually by supporting endothelial health over time. Important safety notes. If you take blood thinners such as warfarin or clopidogrel, speak to your doctor first. Cloves have mild blood-thinning properties. If you are scheduled for surgery, stop using cloves at least 2 weeks prior. Do not exceed the recommended amount. More is not better. 2 cloves daily is sufficient. This should be used alongside your prescribed treatment, not instead of it. Now let me explain something important. Cloves help with inflammation and vessel flexibility, but circulation improves best when you combine this with regular walking hydration, balanced blood sugar, adequate vitamin K2, magnesium glycinate for muscle relaxation. This is not about one magic solution. It is about giving your blood vessels what they need. Margaret's blockages didn't vanish, but her arteries became more flexible. Blood moved more efficiently around partial narrowing. Symptoms improved, function improved, quality of life returned. And that is the goal, not perfection, improvement. Now ask yourself, what if something this simple could support your circulation? What if tomorrow morning you began? 2 cloves, chewed thoroughly, every single day. The cost is minimal. The risk is low. The potential benefit is meaningful. Before you go, comment below. Do you struggle with cold feet? Pain when walking? Have you been diagnosed with circulation problems? Your story may help someone else. If this information was helpful, share it. You never know who is suffering quietly like Margaret was. I'm Dr. Emily Carter. Stay consistent, stay proactive, and take small steps that support your circulation every single day. I'll see you in the next video.